This month, September, is Perimenopause Awareness Month to help more women understand this transitional phase that we will all go through one day.
WSFA 12 News reporter Bethany Davis is live this morning at Baptist South with an expert to help educate us. And Bethany, there's a real need for a month and awareness like this.
Yeah, listen, because every single woman in the world is going to go through this transition at some point. This is the transitional phase that leads up to menopause. But boy, it seems like we just don't talk about it enough. In fact, a Clue survey found that 70% of women don't even know what perimenopause is, and 90% don't feel well informed about it. So we brought in OBGYN Dr. Jasmine Johnson to help us be a little more informed. We're so glad to get some answers from you this morning. Let's first talk about perimenopause, the symptoms, the signs. How do we know when we've entered this phase?
A lot of women recognize it first by irregular periods. That's kind of one of the first hallmark signs. Lengthening of your periods, the shortened time between your cycles, sometimes heavier or sometimes lighter bleeding. Another thing is hot flashes, night sweats, mood irritability is kind of a key. Sometimes you won't even notice it, but other people will be like, are you okay? Sometimes lack of sleep, so just feeling tired, is definitely kind of the first couple things. There are some other things that can happen, it's like vaginal dryness and issues like that, but those are kind of the three big ones.
I think a lot of us, we've heard a lot about menopause, the change, but we don't talk enough about this phase that leads into that. So we kind of have maybe formed some misconceptions, some misunderstandings. What are some of the most common misconceptions or misunderstandings you hear?
All right. So a lot of people think that there's a specific test that determines whether or not you're in perimenopause. There isn't. It's a clinical diagnosis, and it varies in length for people. A good kind of idea of how long perimenopause might be for you is to look at your mother or your sister, especially if they're older than you, your sisters, and figure out when they went through menopause. Ideally, perimenopause can be 5 to 10 years before. I know it sounds like a long time, but knowing that some people can, it's not a huge issue for them. But again, if you're having heavy issues with your bleeding, or you're like, I can't get through my day without changing my clothes because I'm sweating or I'm losing sleep, please talk to your doctor.
Let's talk a little bit about support. It is nice to have a mom or an older sister. We don't all have that. Where can we find support for those of us who are finding ourselves going through this?
Well, definitely your friend group. I mean, for sure. Just talk about it. It's one of the things that we just don't talk enough about, but there's nothing to be ashamed of. We all go through it. So please talk to your friends about it. But by all means, talk to your doctor. Just be like, hey, is this normal? I just have a couple questions. They'll be glad to answer them for you.
Yeah, I think that's what this month really is all about, is starting this conversation so that maybe we can be a little more informed. And I think it helps sometimes to just hear that we're not alone as we go through this transitional phase. It does begin for some women in their 30s, but typically for most women it's between 40 and 44 years old. And this month is just all about helping us to better understand what perimenopause is, how it affects our bodies, and understand the signs and symptoms as we navigate through this phase.
Good information impacting a lot of our viewers. Bethany, thank you for the update there. Now, Clue, that's an app for women declared September Perimenopause Awareness Month for the first time last year.